Politics now. Health care remains a keystone issue for Rhode Island voters and providers, with the latter hoping to force candidates to take a stand today. And NBC 10's political reporter Bill Rapley has more.
Every year, the Rhode Island Health Center Association invites candidates to their annual meeting. And this year, the response included each federal candidate, both Senate and congressional, and the candidates for governor and lieutenant governor. And this audience was listening to what the politicians were saying.
The real reason that we invite them to come is because we need them to really understand how many Rhode Islanders need to use community health centers. So it was as much about having them there, you know, and making some kind of a commitment. We're writing down what they're saying so we can say, remember when you were with us last year and you said X, Y, and Z?
The patients who go to health centers generally do not wield a lot of political clout, but the survival of these centers is important for all of us.
Including the hospital emergency rooms and outpatient departments, 1 out of every 4 visits by an uninsured person in America for ambulatory care is at a health center. That's how significant they are.
And when the politicians stake out their positions, what this audience of health center professionals is really listening for is the sound of money, just like every health center in the country.
I do not talk to a single health center that doesn't tell me that they are struggling to keep that head above water with the rising numbers of uninsured and, importantly, underinsured people who are coming to them for care because they simply have no other affordable option.
And apparently no single politician does not agree that health centers are crucial to keeping the safety net intact. But what these professionals will be watching is whether the leaders vote for funding with the same enthusiasm. Bill Rapley, NBC 10 News in Warwick.
Thanks, Bill. Candidates in 5 races from U.S. Senate to Lieutenant Governor promised to fight for local health centers. At an annual gathering today, it was the yearly meeting of the Rhode Island Health Center Association. Each candidate suggested that the centers need financial support. 125,000 Rhode Islanders use health centers every year, and they're often the health provider of last resort for the uninsured or the underinsured, both in Rhode Island and nationally.
Health centers provide more health care over the course of a year to the uninsured than all the emergency rooms in America. In fact, twice as much.
Well, that fellow is from the National Association of Community Health Centers, says he's never seen a forum that included so many office holders as today's.
All right, Jim, we'll see you then. All of Rhode Island's major political candidates were in Warwick this morning discussing the vital issue of health care. ABC 6 reporter John DeLuca joins us now live in the newsroom with the details. John.
Melissa, millions of Americans are uninsured while millions more have sky-high deductibles and copays. What can be done to make sure this country has universal health care coverage? Well, we got an idea this morning during a forum on the critical issue. All the major party candidates were there, as you mentioned. They were there for a health care forum. Politicians touched on their plans for expanding health coverage for all Rhode Islanders, plus addressing the skyrocketing cost of Medicare. First off, the crowd heard from Senator Chafee. He stressed the theme of partnerships when asked about how to stop the growing number of uninsured Rhode Islanders.
My role, I think, is that the federal government has to participate as these states venture into forming their own plans. And I think that we should, as everybody in this room, have a partnership, federal, state, and community centers working together on this difficult issue.
I think the key templates for that reform also provide something very significant, which is a path to universal coverage. We simply have to get universal coverage for American families in this country, and fast. The 3 ways that I think you need to do it are to invest in information infrastructure at the national level.
Mr. Whitehouse added that there also needs to be a focus on quality of care and reform of the way reimbursements get done. The forum was the headline event for the annual meeting of the Rhode Island Health Center Association. Live in the newsroom, John DeLuca, ABC 6 News.